If you've been told to stretch your hamstrings for sciatica pain, that actually may be making your pain worse. Let's talk about what is going to help relieve your symptoms and decrease that sciatica pain right now. I'm Dr. Amy, and we are empowering women with changing bodies to move pain-free. I also hold a PhD in orthopedic manual physical therapy and believe that movement is life, and you deserve both. We're going to start off with a brief description of what sciatica is, what causes sciatica, before we get into the top 5 exercises that I recommend doing if you have sciatica symptoms. And then at the end, we will talk briefly about the things what not to do if you have sciatica. If you'd like to learn more about what not to do with sciatica, I'm going to have you check out this video over here. We will also have that video linked at the end of this video. And I will tell you that those things are super controversial. That is actually my most popular video on YouTube to date, is what not to do with sciatica. And I get lots of comments that say it's totally different than what everybody else says on YouTube. It is totally different than what everybody else says on YouTube, and that's actually the reason why I made the video. And this video is no different. It is going to be absolutely the opposite of what you've heard everywhere else on YouTube. But let me remind you, I do have a PhD in orthopedic manual physical therapy, and I have been a PT for 25 years. So it can't hurt to listen, right? All right, what is sciatica? Sciatica is a sharp shooting burning pain that can start in the low back, travel through the back of the hip, down the back of the leg to the knee, where it splits at the side of the knee and it goes down the back of the calf as well as the side of the calf. And there are some branches that even go down into the foot. Now, if your pain is traveling in a different pattern than that, you do not actually have sciatica. You could have another nerve that's irritated. I'm going to link a video here that talks about if you have pain on the outside of your leg or the lateral leg, that's a different nerve that's out there that could be causing your symptoms. Now, you may have pain that is shooting down the back of your leg, but you may not have any pain in your low back. And this still can be sciatica because the sciatic nerve can get pinched anywhere along its path. So most commonly, people are either struggling with sciatica that starts from their low back, either from a spinal stenosis or a disc herniation, sciatica that starts in their hip, the back of their hip, that's a piriformis syndrome. So the sciatic nerve actually goes through the piriformis muscle or underneath or on top. It's a genetic anomaly and we have all of them in our population. But if it's underneath the sciatic nerve or going through the sciatic nerve, if the muscle gets tight, it puts pressure on the sciatic nerve, which can cause sciatica. Great thing, it can also be aggravated by inflammation at any point along its path. Most commonly, that will occur in the low back, the hip, or even the side of the knee. So if you have like a sharp shooting pain that is going down the back of your calf, the side of your calf, and maybe you have some numbness and tingling in your feet, that could still be sciatica even if you don't have low back pain. Now, I started off this video by asking you not to do hamstring stretching, and you're probably wondering at this point, why is it so bad to do hamstring stretching? Well, you see, here's the thing. Muscles love to be stretched, so that seems like hamstring stretching would be a great idea. However, nerves do not like being stretched at all, like not even one little bit. They just really don't like it. The challenge with the hamstring stretch is that the sciatic nerve is running in and out of the hamstring as well as the entire length of the hamstring. So anytime you are doing a hamstring stretch, you are indeed stretching the sciatic nerve. Now, if your sciatic nerve is not irritated, this isn't really a problem. Like, nerves don't get that angry about being stretched if they're normal and healthy. But you have a sciatica and you start stretching that nerve, it is going to get unhappy quickly. The next question I often get asked if we're not allowed to stretch the hamstrings is, how do you feel about neural flossing? So neural flossing is the idea that all of the nerves are connected throughout our entire body. So we've got the brain, we've got the spinal column, we've also got all the nerves that go down into our hands and our feet. And indeed, they are connected. The idea is that if it's stuck in one spot, you can floss it just like you're flossing your teeth, back and forth, and you can get it unstuck. which would work if you could actually get it unstuck. But most of what I find with working in the clinic is when it's stuck in something due to a reason. So either there's some scar tissue, there's a tight muscle, there's some inflammation that's holding that or tethering that sciatic nerve down. And then you try to floss it, but it can't actually floss because it's tethered down, which means you end up stretching it, which we talked about. That's not a good idea. I don't recommend sciatic nerve flossing in general, especially when that sciatic nerve is super, super hot. And by hot, I mean it's acute, it's shooting, sharp, burning, numbing, tingling, all that stuff. But I do sometimes recommend sciatic nerve flossing for people who have a chronic sciatic nerve light tension. So how you know if you have that is if you have pain in that pattern, but it's more of a dull, achy type pain as opposed to a sharp, shooty pain. Sharp, shooty is a hot sciatic, whereas a dull, achy is like, it just feels like it's still like going on. It's not really that sharp, shooty type of pain. If you have some dull, achy sciatic nerve symptoms, you can try flossing and see what it does to your symptoms. But please, if you have sharp, shooty pain, do these exercises instead. Why do these exercises work? Your goal with anything you're doing, including exercise, should be to reduce the inflammation and reduce the irritation of the sciatic nerve, because then it will actually calm down. These exercises are extremely gentle, they are restorative, and they're really focused on that deep stability. So getting the small muscles to work better to help support the entire body. All right, you ready to get into it? Here we go. So first thing we want to do when you're suffering with sciatica is we want to calm the nervous system down. We want to make sure that we're getting that good deep breathing. When we do that deep breathing, we also get activation of the vagus nerve, which helps to calm the system down and get us out of fight or flight. So this is a great place to start when you're suffering with sciatica. To do this, you're going to breathe in through your nose and you're going to breathe out through your mouth like you're blowing out a birthday candle. The goal is to get that diaphragm expansion here. We're also going to do a little bit of an abdominal squeeze at the end, and I know that that can be hard to see. I apologize for that. I'm going to use my hand here to kind of show you what my abdominals are doing. Little extra squeeze at the end. Now notice when I'm doing that my low back is staying in the same position. I'm not trying to do that abdominal contraction and cause that tilt. I want to leave my spine in that neutral position. Sometimes doing that tilt can actually increase pressure on the sciatic nerve and cause pain. So some people need to put their hands underneath their back to make sure that their back is not moving. You can try that if you find that this hurts your back while you do it. That would look like this. So my hands just help remind me that we don't want to be moving that low back. If it helps, do it. If it doesn't and it distracts you, don't do it. Some people like to put their hands on their abdominals so that they feel what's going on up there. Whatever works best for you, that's where your hands should be. All right, while we're in this position, we're going to go ahead and do our next exercise, which is our glute squeezes. So the goal with this one is to squeeze the glutes. But again, we don't want to be rocking or moving that low back because we don't want to be aggravating that sciatic nerve. So when you're doing that, you're going to be squeezing your glutes together, again, without moving that back. And you're going to hold for 5 to 10 seconds and then relax. And then you're going to relax for 5 to 10 seconds, however long you squeezed for. You're going to do a total of 10 of those to get those glutes really, really activated. That's really important to help support the low back and decrease tension on the sciatic nerve. Now, the next thing we're going to do is a Soaz stretch. And I know that there are tons of Soaz stretches out on the internet, and there's all kinds of different ways. Many of them are much more aggressive than the one I am going to show you. I feel like this is the best one to start with when you're suffering with sciatica, because it really puts your spine in a neutral position. It helps you maintain control of your pelvis and your spine while also getting a good stretch to that psoas. Now, in all honesty, when I usually do this, I would not do this on a table that is this low. I do it on something a little higher because I'm 6 feet tall and I need more room. But even with a low table, you can do it correctly. What you're going to do is drop one leg off the side of the table. So I'm going to scoot my pelvis over a little bit again, so I'm really well supported. And I'm going to drop one foot off the edge of the table. So when I put that foot off the table, for me, if I put it here, I'm not feeling any stretch on the psoas, which is in the front of that hip. And so what I'm going to do is I'm going to scoot that foot back and then allow that knee to drop further down. Now I can feel it through the front of my hip gently. I also feel a stretch through my quads because my knee is so bent, which is fine. It's just a bonus. Now, if you are in a position and you're like, I've got this foot down, I've got it as far back as I can go, my quads are stretched and I'm still not feeling it in the front of my hip, then to ramp it up a little bit, what you're gonna do is you're gonna bring this other knee towards your chest. Now you can see when I do that, this knee is going to start to come up. So watch it, because my psoas is stretched at this point. So watch what happens with my knee here. See, as I bring this knee up, you can see how the other one wants to come up too, right? So then I got to kind of push that back down. Now this is a pretty big psoas stretch for me. I don't need to do this. But if you find yourself in this position and you're like, I'm not feeling it, just beware that if you bring this knee up, what's happening with this knee? Okay, you want to watch that, because if this knee is coming up and you can see what's happening here, this knee is starting to come up as I pull up in here, then I've blown past the psoas and I'm getting down into that quadricep. So then I need to push that knee back down to get that good psoas stretch. So for that one, you're going to hold that stretch, whatever is a good stretch position for you, for 10 seconds. Then for me, I would just bring my foot out and relax it for 10 seconds. So now I'm not stretching my psoas and I'm not stretching my quads at all. And then I would go back into it for 10 seconds. You could also switch over to the other side as long as it doesn't hurt your low back or your sciatica to do that. So up next, we're going to do some quadruped rocking, which means we're going to be on our hands and knees. That's what quadruped means. And you should feel well supported on all four of these points, because you want to make sure everything's really, really equal. Now you want to find that neutral position for your back. So I like to kind of move around a little bit and be like, okay, where am I in neutral? I tend to be kind of hunched, so I always like to push up through here, but that's not actually what we want for this exercise. So I'm going to find that neutral position, and then we want to make sure that we're not sticking our tail up too high, but also we don't want to be arching. That's not the goal of this exercise. So we want to find where is that kind of neutral position, and it should feel pain-free. You should not have any pain when you're in this position or when you're starting this exercise. Now that we've got the spine in that neutral position, what you're going to do is you're going to move your weight over your hands and move your weight over your knees. Now to start out, this is a really, really gentle exercise. And what it does is helps to activate those smaller muscles in the spine and the hips to get them to kick in more. Again, this exercise should be pain-free, and it should start with a very, very gentle rocking. We want to do about 20 rocks back and forth, and that will help to get those muscles, small muscles, activated. So the last exercise we're going to do today is my absolute favorite for activating those little muscles in the lumbar spine. They're called the Multifidi, and they are the guide wires, and they help to keep everything moving correctly so those joints don't jam into each other. But it's a very small exercise, friends, very small. So what you're going to do is you're going to start in a neutral position, so your knees are bent, your feet are flat, and you're going to bring your knees just a little bit to the side, just until the opposite hip starts to come off the table. Now, we're not going all the way till that opposite hip is all the way off the table, okay? It's just a sensation that it's starting to come off the table. Then you're going to use the muscles here, your abdominals, to push back down, which brings those knees back.
So knees go down, hip just starts to come up, and then you're going to squeeze those muscles there to bring those knees back. Knees go down, hip comes up, hip goes down, knees come back. Knees go down, hip comes up, hip goes down, knees come back. Now, this is not a knee wagging exercise, friends. Okay, you can do a knee wagging exercise, but that's not going to get the activation of those abdominals, which also helps to increase the multifidi activation. So we really want to be focused on this muscle over here that is activating. Might be helpful to put your hand here so you can feel the muscle activating, as well as your hand underneath your hip so you can start to feel when it comes off the table. Knees go down, hip comes up, hip comes down, knees come back. You're going to do 20 to one side, and then you're going to do 20 to the other side. We do not go back and forth because that creates a lot of havoc and it's difficult to keep control of the muscles we're trying to activate.
All right, so now that you know what to do, let's talk about what not to do. We already talked about not stretching the hamstrings, but that is a point that's worth repeating. We don't want to sit for long periods without movement. If you sit at a desk for work, I'm going to recommend setting a timer that you get up a minimum of once an hour. I'd walk around for 5 minutes. I would also drink water during that time, because then in about a half hour, you're going to have to get up again. And hydration is important. You want to avoid positions that are aggravating initially. So things like deep bending or rotation can often in the beginning stages be extremely aggravating. So you want to avoid anything that's going to aggravate your symptoms. Now, tip number 4 seems like exactly the opposite, so give me a moment to explain. You do want to move as much as you can pain-free. So this is a challenge when you have sciatica because basically everything is aggravating. You sit, you stand, you walk, you shower, you lay down. It doesn't matter. Everything is aggravating. So it's hard to hear this advice of don't go into aggravating positions, but also keep moving. So if you have a really bad case of sciatica and it feels like you have constant pain, then for you, what I want you to do is avoid any activities that increase your current pain. So whatever activity it is that causes your pain to actually get worse, that's what I need you to avoid. And I understand that in the beginning, for the first couple of days, that can be a lot of activities. So you may need to switch between tasks multiple times per hour so that you can try to stay in as comfortable a position as possible until some of that inflammation goes down. Definitely make sure you're icing for 5 minutes every hour to decrease your symptoms and remain as pain-free as possible during those first couple days. Oh, and please, whatever you do, stop using heat. This is super controversial. I understand it goes against what everybody else says on YouTube. However, here's the thing. If heat increases blood flow to the area where you have your sciatica, then it's going to increase the inflammation around that sciatic nerve. If it increases the inflammation around the sciatic nerve, is it going to make you feel better or worse? Worse. We actually said that inflammation was one of the things that can cause sciatica. Please stop using heat. Because best case scenario, you're increasing blood flow to an area that is stagnant, that your body is not able to clean out on its own. A couple things that I want to make sure that you do remember to do is to be consistent. Healing can take time, and the goal is to see a little bit of progress every day. So you want to be doing these exercises multiple times per day as long as they don't increase your symptoms. If you start to notice that your symptoms are worsening or that you're losing muscle strength, then you definitely want to seek help from a medical professional because losing muscle strength is definitely a concerning symptom. Yeah, I know pain's not great, but losing muscle strength is definitely worse. If you found this video helpful, give it a thumbs up. If you found it super controversial, please give it a thumbs up. Don't forget to subscribe. And if you want to check out my super controversial video about what not to do with sciatica, go check out this one over here.